Hello, welcome back to S Medicine. Today we are going to discuss about tonsillitis, paratonsillar abscess or quinsy, retropharyngeal abscess, acute bacterial epiglottitis, and acute laryngitis, tonsillitis, caused by staphylococci or streptococci, may be acute or chronic. There is an enlargement and redness of tonsils. Acute tonsillitis may progress to acute follicular tonsillitis. Acute tonsillitis is associated for development paratonsillar abscess, quinsy. Chronic tonsillitis is caused by repeated attacks of acute tonsillitis. Tonsils become small and fibrosed. Paratonsillar abscess, quinsy. Paratonsillar abscess or quinsy occurs as a complication of acute tonsillitis. The causative organisms are staphylococci or streptococci. Acute pain in the throat, trismus, difficulty in speech, and inability to swallow. Glands behind the angle of the mandible are enlarged and tender, retropharyngeal abscess. An abscess in the soft tissue between the posterior wall of the pharynx and the vertebral column occurs due to infection of the retropharyngeal lymph nodes. It is more common in debilitated children. A chronic form of the abscess in the same location is seen in TB of cervical spine. Cold abscess. Acute bacterial epiglottitis, predominantly affecting young children, caused by Haemophilus influenza. Pain and airway obstruction are the major findings. The onset is abrupt. Failure to maintain an open airway for a child with this condition can have fatal consequences. Vaccination against Haemophilus influenzae has greatly decreased the incidence of this disease. Acute laryngitis. It is an acute inflammation of the larynx. May be caused by infectious agents, viruses, bacteria. Inhalation of irritants, cigarette smoke. Mechanical factors, endotracheal intubation. Overuse of the voice. Two uncommon but important forms of laryngitis. Tuberculous. Diphtheritic. Tuberculous laryngitis occurs when infected sputum is coughed up. Diphtheritic laryngitis occurs when Corynebacterium diphtheriae is inhaled and implants on the mucosa of the upper airways. Sequelae of acute laryngitis. Resolution. Spread of infection may occur throughout the respiratory tract. Airway obstruction due to laryngeal edema. Acute laryngeal edema. It is an acute inflammatory condition causing swelling of the larynx. Acute laryngeal edema may occur due to trauma, inhalation of irritants, drinking hot fluids, infective in origin, may lead to airway obstruction and death by suffocation. Chronic laryngitis, commonly seen in heavy cigarette smokers. Permanent thickening of the laryngeal mucosa and submucosa, with associated excess production of keratin, smoker's keratosis. Dysplastic change in the basal layer can occur. This is a predisposing factor in the development of squamous carcinoma of the larynx. Laryngotracheobronchitis, croup. Life-threatening acute inflammation and obstruction involving the larynx, trachea, and bronchi. It usually affects young children aged 6 months to 3 years, typically caused by viral infection. Parainfluenza virus is the most common cause. Respiratory syncytial virus also may precipitate this condition. It is self-limited, may cause frightening inspiratory stridor and harsh persistent cough, a rising pulse rate, restlessness, and cyanosis. Occasionally, laryngeal inflammatory reaction may narrow airway resulting in respiratory failure.